Greetings, well-beings. We're back with another reaction to the hit show Pitt on HBO Max. This is episode number 9. This one's kind of feisty. It starts off with a bit of a fight scene and ends with a fight scene. Let's get into it.
She has allergies, you f***ing Fauci zombie!
Ooh!
Allergies! Take it! It's not! Hey! Hey! That's enough!
Honestly, this should not be happening in 2025. Grown women should not be punching each other in emergency rooms where there's already so much stress and tension and anxiety. So I'm going to talk to you about human bites and dog bites. Human bites are actually more infectious and more dangerous than dog bites because humans have a little bit more bacteria and viruses like HIV and hepatitis that can spread. And then dog bites also have staph and strep pastorella. Both human and dog bites are treated with augmentin, which is an antibiotic that treats infection prophylactically. And if the fist wound has broken skin, it needs to be evaluated by a hand surgeon because hands are one of the most important appendages of our bodies, and they're actually really complicated anatomically. So you need an orthopedic surgeon that specializes in hand surgery to take a look at your hand. Basically, all bites that break the skin, no matter whether it's a human or a dog or a kid or what, need evaluation because infection can develop within 12 to 24 hours of the skin being broken. Remember, your skin is a really important barrier, probably one of the most important organs of the body that we take for granted, but it is protecting your body.
Ridiculous. All I did was offer to put a mask on her child who's been coughing for over an hour. He's allergic to cat dander, like I f***ing told you. My sister got her to
Shut up right now, please. And only answer the questions I ask.
She's like a Chris Voss FBI negotiator right now, where she's like, stop, shut up, and answer the questions that I need asked.
Okay. Oh, did you want me to tell the surgeons to go no mask for surgery?
What?
Those of us who save lives for living believe strongly that masks minimize risk when it comes to spreading disease and
Okay, this resident doctor is awesome. He just totally called her out on her own thing, was like, so no masks for the surgery that you're about to do? And look, she wants her mask.
good call.
The truth is the COVID pandemic really taught us all about personal responsibility. We all learned how to wear gloves, wash our hands better, and wear masks on our own faces to personally protect ourselves and our loved ones. Masks prevent disease transmission. It's called a droplet or contact, and respiratory viruses specifically, even if it's allergies, quote unquote, it is really good etiquette to wear a mask or don't be out in public, especially on planes. People are traveling a lot in the summertime, and I want to empower everyone to carry a mask in their own purse or handbag because you never know when you'll need it.
Pitt Fest OD.
Keely Ralston brought to the first aid tent at Pitt Fest with altered mental status and fever. Send off a rainbow.
On it.
Okay, this is like crazy because they're at a festival. She said they said Pitt Fest and OD. So we're thinking what drugs could be overdone that could cause high temperature and fever. Altered mental status, the patient got intubated, meaning they couldn't even protect their own airway. So he just said send off a rainbow, and that literally is slang in the ER for send off a broad test of blood panels, which is like the lavender top is for the CBC, the red top, don't quote me, is for the chemistry, the green top is for the lactate. I think I know that one, and I think the lactate needs to be on ice, and the blue top, and all the different test tube vials.
Heart rate 132, 4 of Ativan in the field.
Pupils are dilated, definitely MDMA overdose.
4 more of Ativan, please.
Core temp 107.3.
Okay, can we get another hose in here before she fries her brain, please? Let's go. Come on.
107, that is a very high temperature. I recently had a situation where I had my nephew who was partying and out in the sun and college frat boy. He got really dehydrated and sunburned and got a viral infection. So he had a really high temp as well. If we don't cool down our body fast enough or well enough, our brain can have seizures. We can literally fry. So what my mom used to do with us when we were kids, which is really funny because that's what I want to do with my nephew, set up an ice bath in the bathtub, meaning cold water and then a few cubes of ice. But that is one of the fastest ways to reduce the body temperature. And that's what they're setting up in the show.
Gentle, gentle, gentle. Houston, we have splashdown.
Good luck. See you on the next one.
Yep.
Temps down to 107.1.
Why is she on the ice, Dr. Santos?
To bring our temp down.
Wow, state the obvious, yet still don't answer the question.
The quicker we bring it down, the less of a chance for permanent damage to the brain, liver, or kidneys.
Brain, liver,
Exactly.
and kidneys.
Was she
Okay,
sweating?
so is she sweating? When we're really hot, we sweat a lot, but we lose a lot of electrolytes. We can go into kidney failure, we can go into liver failure, our brain can have seizures. There's some old wives' tales that say that you need to cover up when you have a fever and wear like a beanie and socks and a hoodie and just get real warm.
I feel like complete
That's not true. Like, don't go into a sauna when you have a fever. Don't make it worse. Like, your body already has internal mechanisms and temperature regulation systems that can reduce the fever by letting you sweat. You need to sweat. So when you cover yourself and you make yourself hotter, you're actually making it worse. And secondarily, don't avoid Tylenol as a fever reducer. You have an inflammatory cascade cytokine system that's completely activated during an illness, and you want to reduce the fever. You want to enter a cold situation. These popular influencers have made ice baths and cold showers like very, very exciting and cool. And while they are, and don't get me wrong, they get your body stimulated, the dopamine rush, you get really excited, the mental discipline required to stand in a cold shower. Hey, I get it. I've done it. But at the same time, there's no medical benefits for taking cold showers every morning. There's a Wim Hof method where Wim Hof suggests sitting in the cold for, I don't know, actually the protocol personally, but some people have died from that because not everyone can handle that. So be careful what advice you take online.
Walter Purnell, 52, walking his dog in the crosswalk, got struck by a Chevy Impala.
Whoa, major road rash.
Yeah, the car didn't hit me so much as throw me. This is the first day I've worn shorts I left in here.
No deformity at the knee or ankle. Distal pulses intact. 4 of morphine so far.
Yeah, feel free to be more generous.
Who's your friend?
Oh, this is Crosby, who thankfully barked and warned me, so I had half a second to try to move out of the way.
Crosby, you're a hero.
Crosby's a hero. Okay, that's so sweet. I've seen so many pedestrians get hit by a car. I lived in Santa Monica. People actually drove on their electric scooters, and I've personally seen people flying off their scooters not once, but twice. So I felt like it was an important segue here to share that there are ways that we can reduce the impacts of pedestrian on vehicle actions. One's obviously when you're driving, do not text, no texting and driving. Do not be doing anything but focusing on the road. But pedestrians too, wear bright clothes. Make sure you look around and triple check your surroundings. Obviously, alcohol involvement, whether the pedestrian or the driver, don't drink and drive.
Oh my God, there are literally hundreds of different MDMA pills. These names, BMW 5, Jurassic Park, Red Superman.
Well, what is the chemical molecular structure of MDMA? It is actually a methamphetamine. That is the backbone of MDMA. The MD stands for methylene dioxy. Methylene dioxy, methamphetamine.
Maybe she needs more Ativan.
No, she's had 20 already and her vitals are stabilizing.
Another 4 of Ativan and peppergram pepper.
I don't think this is a CNS problem.
What they're debating right now is like, why is she still seizing when her temperature is down? So they're having like an active conversation, which is so important in healthcare, which is why healthcare influencers online can't really give the advice that they're giving because medicine's very nuanced. So Keppra is a medication that we use for seizures. It's generally pretty safe, but it's for treating a CNS problem, a central nervous system problem. And so they're debating what are the causes of seizures in this situation. So causes of seizures can be like the brain stuff, which is like brain tumor, a stroke, a head trauma. Then you could have electrolyte or metabolic abnormalities. The most common reversible one is a low sugar level. A low sugar can cause seizures. Low sodium can cause seizures. People that have low sodium are generally people like this patient who have been sweating at a rave and who haven't probably eaten or drinking a lot of water and super dehydrated. Those are some of the common causes of seizures.
She needs saline.
We don't have her last back yet.
At festivals, you dance for hours, you sweat, it's low sodium, hypernatremia. She needs 100 cc's of hot saline.
We don't know her sodium levels.
Hydration for sweating and dehydration really needs replenishment with sodium and electrolytes, not just water. So the chemical structure is different. So first she says saline, which generally we mean 0.9% sodium chloride. But then she says 3% saline. It's a higher concentration of sodium. The point I'm trying to make is when you exercise a lot, when you are drinking a lot and you're dehydrated, you're in the sun, you really need to replenish with electrolytes.
Hello? Can you hear me now? Huh? Hello?
Whoa, sir, what is the issue?
Oh, same issue. I've been here all day, and you people have done nothing to help me.
We're still waiting on your second troponin. We can't clear you medically until it comes back. For instance, if it comes back elevated, that could indicate a silent heart attack, and you'd need to be admitted for monitoring in a cardiology consult.
That's all I'm asking.
Go Javadi.
I'm afraid I've had a silent heart attack. I just want someone who knows something about hearts to tell me what's happening to me. You know, unlike most of these losers, I have
Oh,
insurance. Good
no.
insurance. And I pay my taxes, which pays for them to not have any insurance.
Sir, you've got about 5 seconds to change your whole attitude before security.
Go, Dana. Yes. First of all, the medical stuff, she's right? We're checking your troponins. We're trying to see if you had a silent heart attack. In my opinion, the more emotionally erratic and crazy upset people get, the less likely there is actually something happening. The sicker patients that I've had are really kind. He has health anxiety. He's scared and he deserves the right to be scared, but he does not reserve the right to bang on windows and berate the entire emergency room. Total red flag.
I'm leaving.
Okay, bye.
Hey, you are absolutely free to go, but if you do, you will be leaving AMA against medical advice. This form states that I have advised you to stay and complete your evaluation.
I love that he's on a microphone.
Understanding and accepting all risks of heart attack, stroke, disability, and death.
People have signed against medical advice on my watch. It does feel bad because you're like, did I fail this person? Why are they leaving? You know, it's like a breakup that you never really wanted. But at the same time, it is empowering because it's like, you don't have to stay here if you don't want to. This is all a choice. Against medical advice forms basically say, you know that if you leave this place, we haven't discharged you. You haven't been formally discharged because legally, every time you're in a hospital setting, like that's why you can't take your own Tylenol from your purse or your own Tums because technically the healthcare team is responsible. Hospitals are responsible for your health. So if you leave, you're not discharged, you left AMA.
Cords.
Looks good.
I'm in. Connect the bag.
Nice.
Good breath sounds bilaterally.
Temp is 102.4.
What? Is this septic shock?
Okay, we need to assume the worst here.
Code sepsis, 2 sets of blood cultures, lactate, 30 per kilo of LR, and 4 antibiotics, ceftriaxone.
No, she was just in the hospital. Peptazo and Becco.
Got it.
Okay, once the temperature was 102.4, which clearly it wasn't the first time she came to the ER, they were like, is this sepsis? Sepsis is such an important disease that they initiated a Code Sepsis campaign. And sepsis is important to recognize that it's an infection and your body's overwhelming response to the infection where it can't compensate for the infection. So that's why whatever cough or colds you guys have and whatever infections that might be going on, a cellulitis on the leg or rhinitis or sinusitis or whatever, you've really got to get ahead of the dehydration aspect of it. So aggressive fluid replacement, early antibiotics, Code Sepsis is a really important thing to pick up early because it can lead to mortality and death.
This is sepsis. Where is it coming from? What's the source?
Urinary tract infection.
It's not a UTI. We catheterized a urine half an hour ago.
Your specimen could have been contaminated this morning.
Is it pneumonia?
Chest CT negative.
She was altered meningitis.
She's postpartum.
Endometritis. The CT of the uterus shows a thickened endometrium, but that's normal postpartum.
We'll do a pelvic after she's stable.
And from the cervix. Got the culture?
Pus from the cervix. Okay, well, that's pretty diagnostic if I ever knew. But basically, sepsis needs to have a source of infection to be called sepsis. So if it's like UTI or pneumonia or cellulitis, or in this case, endometritis, sometimes if we don't know where the infection's coming from, we'll scan the patients and we'll think of meningitis. But like she had just had a baby. So Robbie was like, you know, think of what's the most obvious. So her endometrium, which is the lining of the uterus, got inflamed, infected, and purulent drainage, which means pus. She did a cervical exam and caught a piece of the pus basically, and we'll send it off for culture hopefully, but she's already been on antibiotics, so it might change the culture results.
Source. The positive urine this morning was contaminated.
Let's talk about contaminated urine specimens. This is exciting because when you give a urine sample to anyone ever in life, anytime any doctor asks for it, wipe with the thing they gave you, remember, from front to back, and then let the first few drops of urine go in the toilet and then catch a clean catch, which means a contaminated urine specimen is so common. It has the skin flora with it, and skin flora has different bacteria on it, so therefore the urine is not a sterile sample. But basically, don't give contaminated urine specimens to your labs and to your doctors. Make sure it's a clean specimen. If they don't give you a wipe, ask for one and let the first few drops go in the toilet before you catch one.
Not so clean catch specimen.
Not so clean catch.
This infection's been brewing for a while. She was probably already septic as the disease progressed, dropped her BP and passed out while driving.
And she wasn't hypotensive when she arrived.
Adrenaline rush from the car crash and the sternal fracture raised her BP.
So this overwhelming response of your body to infection drops the blood pressure. And when the blood pressure drops, that's why it's a huge emergency. You can get into septic shock and lose consciousness and end up like this lady in a car accident.
Hard at work?
Oh my God.
I'll take my chances.
Wow. Okay, not okay. Totally not okay. This poor lady.
He just punched her.
Okay, we're here just trying to stay alive watching these episodes of The Pit. What a great, incredible show. If you like this reaction, make sure to like and subscribe. And if you want to check out another video, here is episode 8 below.